Yourself, maybe in the garage, if it's bad enough that you look online and then you find an urgent care near you.
But don't get in the car until you know that urgent care is actually there. The Let Joe Know team exposing fake urgent care centers popping up in Valley online searches and what it means if you really need immediate help.
They become a less costly emergency room where a lot of us drive to get help with pains and injuries, and most of us find them the same way.
They'll just go to Google and they will search for urgent care near me.
Tom Waddington is a Google My Business product expert. Years ago, Tom says he found a house listed as an urgent care in a Google search.
I was able to tell pretty quickly that, it was fake.
He started searching Google nationwide for urgent cares and says he found empty lots, restaurants, even this dumpster. We found it at Apache Junction, where Acre Urgent Care is listed. Day-night urgent care is listed in Scottsdale. It's got to be right in here. It's not. A Google search in Mesa shows an address for Avid Urgent Care that would be the middle of the road. Fake address, but real phone number.
Okay, so I can't come to the location then?
I'm told they don't take appointments.
They can talk to me by phone. They're going to have a doctor call me.
Doctor by phone. That's the real business. And Tom says with Google, it's quicker and easier to end up high in searches if you list an address, even if it's fake.
They just want that phone number in the search results, in the map results, someone to find it and call.
We found about a dozen Arizona urgent cares showing up in Google searches that don't exist. Addresses led to a mobile home park in Chandler, a busy intersection in Tucson, an elementary school in Avondale. If you need immediate help, the concern is obvious.
They would potentially drive to the place.
Some say they did. Google reviewer Mary says she had shortness of breath. We couldn't find the place. Daniel, the address not at location, really sick, and this is not helping. And Becky says her urgent care address was a junkyard. Maps show a gun and ammo shop. So who's behind this?
I have this sinus thing.
I called with a sinus condition I had at the time. A doctor is supposed to call back. Instead, medical history, medicines taken, allergies, all done in texts. In minutes, there are 3 prescriptions.
Z-Pak antibiotics, prednisone.
To get the medicine, I paid the $196 diagnosis fee and found azithromycin and prednisone waiting. The diagnosis charge came from Fasten P LLC. We found it owned by Alice Minkoff, who also wrote the prescription.
What can you tell me about Alice Minkoff?
Janine Dawn with the Arizona State Board of Nursing confirms Minkoff has nursing licenses here. But we found Minkoff does not have the authority to write prescriptions.
She did submit an application for prescribing and dispensing.
And what happened with that?
In the January board meeting, the board denied that.
The board not only denied her ability to write prescriptions, they issued a complaint against Minkoff's nursing licenses.
Can you tell me why that happened?
I can't.
In November, the Colorado State Board of Nursing suspended Minkoff's nursing licenses for calling in prescriptions without prescriptive authority. They say she made diagnosis that required lab work and or in-person review of symptoms. Instead, they say, on many occasions, it was done solely through text messaging.
This phone does not accept incoming calls.
Yeah.
Message.
They're gone. This was working before.
Fasten P and Minkoff did not return calls and emails. Don says there's a good reason nurses must take further steps to write prescriptions.
If you don't have the education to prescribe, then you're putting the public at risk.
Minkoff's nursing license hearing should be next month. Now, after we contacted Google about this, they say they acted quickly to take down a number of fake urgent care listings in Arizona. They say they've removed other fraudulent Fasten P listings in the past, but Waddington says Google isn't taking these fake listings seriously enough, and it will happen again. I'm investigator Joe Ducey. If you got a problem, let me know.
During this public health crisis, telemedicine has become a safer option for people. But how do you know the person on the phone has the right qualifications? Before the pandemic, the Let Joe Know team exposed the deceptive way one telemedicine business operated in Arizona. And now the state is taking action.
Online searches showed an urgent care center at this address, but it's not here. And on this street in Mesa.
It's got to be right in here. It's not.
The address doesn't exist. We found more than a dozen Arizona urgent cares turning out to be mobile home parks, busy intersections, elementary schools. Tom Waddington says it's easier to end up high in Google searches if you list an address, even if it's fake.
They just want that phone number in the search results, in the map results, someone to find it and call.
It was a telemedicine business. After our story aired earlier this year, Google removed the fake addresses, but no action was taken against the people behind it until now.
I have this sinus thing.
As part of our investigation, I called with a condition I had at the time. I got a diagnosis by text only and had prescriptions waiting.
Z-Pak antibiotics, prednisone, written by Alice Minkoff, who we found had an Arizona registered nursing license but no authority to prescribe medicines.
Next is Alice Minkoff.
In late July, at an audio-only meeting, the Arizona State Board of Nursing took up their complaint against Minkoff. Documents show last year, 9 patients told personnel at a hospital in Parker they received 34 prescriptions by phone, all found to be written by Minkoff. Minkoff said it was a mistake. It was Parker, Colorado, not Arizona. While she later applied for it, Minkoff never had the ability to write prescriptions in Arizona.
Numerous and serious acts of unprofessional conduct that is revoking her registered nurse license.
The board agreed with an administrative law judge's decision, revoking Minkoff's license and nursing certificate. Colorado, Wyoming, and Washington also have taken actions involving Minkoff. So you may ask, if this person didn't have the authority to write prescriptions, why did pharmacies fill them? What is the system? Why did it fail? Good questions, especially during this pandemic. We'll bring you the answers when we can. If you had a similar experience, email me, joe@abc15.com. And see our original investigation at abc15.com/letjoeknow. For the Rebound Arizona, I'm Joe Ducey. If you got a problem, let me know.